Patrick's really young dog has bladder cancer. What is he supposed to do? Let's ask Dr. Lauren Barrow.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Hello, friend. Thanks for joining us today for a listener line episode. We have Patrick, whose very young Irish setter has a mass in the bladder. And joining us to take Patrick's call today is Dr. Lauren Barrow. Dr. Barrow, thank you so much for joining us.
Thank you for having me.
Okay, let's listen to Patrick's question. Patrick sent his question in by email, so I'll read it. Hi. After recent ultrasound, my 1-year-old Irish setter is confirmed to have a bladder mass 3.5 centimeters by 2 centimeters. It is near the trigone region, impeding ability to urinate. We sent in the BRAF test and are awaiting the cystoscopy appointment. 1. Can you estimate chances this is transitional cell carcinoma? If it is there any chance of long-term survival? 2. Is it unheard of at the age of 1? If caused by environmental factors, is it possible to develop it in such a short time frame of exposure? I understand the genetic component, but only have info from the breeders stating the line of 55 total dogs, all free of TCC, and only 2 others presented with cancer after the age of 10. I feel terrible and hope it was not anything we allowed him to be exposed to. Thank you for your time and any resources you can provide. Poor Patrick. Dr. Barrow, I know you understand that pain of feeling guilty about it. Was it me? So let's start there. Let's start with that question.
I'm almost certainly, very certain he did not do this to his dog. So as far as TCC specifically, we don't know exactly what causes it any more than we know exactly what causes any cancer. There may be some genetic components, as he was talking about. Certain breeds tend to get it more often. I know I've noticed that pattern. I didn't think Irish setter was one of them. There have been some studies where they were looking at exposure to toxins. There's one that I ran into about some sort of lawn herbicide that maybe increased that. There's other risk factors that you'll see repeatedly: urban living, which I think they think might be linked to toxins in our environment, obesity, which is probably more of an inflammatory kind of side effect. So there's certain things that you'll see popping up over and over with cancer in general that may or may not apply to TCC. And one thing that I've always thought was very interesting about dog cancer and human cancer is that we have pretty similar rates of cancer, pretty similar types, pretty similar treatments. And that's because we evolved in the same environment. We share a lot of the same environment. And so I don't think that I don't know Patrick, but I have a hard time believing there's anything in his environment that was so toxic that gave his young, healthy dog bladder cancer and no one else is sick. That would be my support of proof of my guess that he did not cause this. And and the fact that his basically puppy got cancer is one of the big tragedies of cancer. It does not care. We study trends and we think we know certain things about what makes a cancer more likely, what's a risk factor, and it's things like age and toxins, and we're always looking for a reason, but sometimes it's just a bad luck, mutation, who knows, wrong place, wrong time. Takes one cell to not get the memo that it was supposed to die at the end of its life to clone itself and make a tumor and wreak havoc and have catastrophic, heartbreaking results. And that's the nature of cancer, and that's why we hate it so much. And so I'm sorry that happened. It's heartbreaking, but you can't blame yourself. It's not your fault. You did everything right. I could tell.
That's right.
He cares.
Yep. Yeah. Yeah. Patrick, you didn't do anything wrong. Cancer is one of our oldest diseases. We had a genetics expert, Dr. Charlotte Hacker. We spoke to her just a couple weeks ago for this show. And so I'll put a link to that in the show notes eventually when we air that. But she said that the same thing. She said she's an expert on genetics, and she was saying there's all of these systems in the body that double check. Should the cell divide? Should the cell? There's multiple steps, and then there's all these checkpoints that the cell has to go through, and one step in those multiple systems can cause cancer. Every day, every cell is going through these checkpoints, and it just takes one time, one mistake, and it's really unfair. So it's not something you can be control of. It's at a cellular level, and there's multiple checkpoints.
Right. And I think also that the grief of having someone you love have cancer, part of that is that you get some guilt. Almost everyone will. I've experienced that myself, but also had a lot of clients that, they brought their dog or their cat to me, and they want to know what they did wrong. What should I have done differently? I want to get another puppy, but I don't want the same thing to happen again. Should we move? I've been giving it filtered water now. Like, you didn't do this. This is mean science happening again.
Right.
It is what it is, but you can't take that on yourself. All you can do is appreciate every day. And if you are unlucky enough, your dog, your cat, your loved one is unlucky enough to get hit with that super, super bad luck, then you do the best you can every day and you run with it. But don't live in the past and question yourself. And I think it's fine you ask the breeder, because if they did come up with some sort of a genetic link, or all of our puppies have TCC, I think that we should go figure out why and do a study on that line of dogs and figure out what is going on there, because that's not what we find. I think he was doing his due diligence, and he was probably operating on some guilt and some automatic love responses there, grief working to call them up. But I don't want him to carry that around. That's not fair.
So what do you think the odds are that this bladder mass, he said 3.5 centimeters by 2 centimeters in the trigone area, that's impeding the dog's ability to urinate? What do we think it's going to come back? Do you think it's going to come back as a TCC diagnosis? Gut feeling?
Probably. The age aside and breed aside, everything else points to TCC. I looked it up before. On Veterinary Information Network, they said that more than half, or up to 70% of bladder tumors, so bladder mass of any sort in a dog, is a TCC. They also tend to grow near the trigone, which is the little point where the urine comes out. And I think the BRAF test is a good follow-up to try and confirm that. It will come up positive, I think 85%.
So then what are we looking for in terms of long-term? He wants to know what are his chances of long-term survival with TCC?
So long-term can be a loaded question.
Yeah, what does that mean?
I tend to compare dog cancer stuff to human cancer stuff. And long-term survival in the human world is 5, 10, 50 years. Like, if this is a 1-year-old, the equivalent of a 1-year-old child or a 1-year-old dog being a human, what's that, like 5, 7, 10, a child getting cancer, long-term survival for that child is going to be 50, 80 years. Let's get back to the normal. We're not going to get that in the dog even because we don't. And it's not fair. So if you're trying to evaluate long-term survival with most cancers, I think most of us would agree I'd be pretty happy to get a couple years, maybe. And I think you ask 100 different people, you'll get 100 different answers as to what's a good long-term survival. And that's the tragedy of your dog's youth having cancer versus a 10 or a 15-year-old dog having cancer, is all of that lost life years. So when he asked long-term survival for his 1-year-old, I wonder what that means to him. Does that mean, is he asking, can we kick it and live a normal lifespan? I would be really surprised. I think there's a pretty good chance no. Could we get a long enough survival time to have some really good months? And if we're lucky and kind of aggressive with it, a couple of good years? Sure. I think that we've got some really good options these days. I think it depends on if it's spread or not. I think it's worth looking into. I would, again, go to the oncologist. Always plug in for them because there's so many different variables in there. And ironically, the fact that he's young and otherwise healthy, and I assume doesn't have other concurrent illnesses, maybe will help him be a little bit stronger and he can, exceed expectations with the treatment, because the data that we have maybe isn't that great because this type of tumor is fairly aggressive, but that's also an average, a mean, a median, whatever you're looking at. That's not everybody. So there's always hope there as long as there's hope there. So
that's an excellent point, that statistics don't apply to individuals ever.
Right.
And so whatever number you're hearing is not actually your dog's number. Your dog's number is what you will find out.
Right. And also, dogs don't read textbooks or studies. So
that's why we love them.
That's a part of the reason I keep my dogs around. So this is a really horrible, sad situation that Patrick and his family and they're going to have to deal with. And balance your heart and your mind with this whole situation. And it's going to suck sometimes, but go out there, get your answers, get your information, see what the BRAF tests, cystoscopy. Maybe the other thing is, it's probably TCC, but probably isn't 100% either. So let's get the info. Let's see what happens. That's what I would say. One step at a time.
Well, Dr. Lauren Barrow, thank you so much for joining us today and taking Patrick's question. We so appreciate your heart and your insights.
Oh, well, thank you. Thanks for having me. It's always fun to talk to you guys.
Patrick, thanks so much for writing in with your question. We really appreciate it. Viewer, if you have a question about dog cancer, whether it's one you already sort of know the answer to because it was a question you had early on and now you know, or if it's something that you're truly curious about right now, feel free. Send us an email at info@dogcancer.com, leave it in a comment below, or call our listener line to make an audio recording, which is always the best way for us to use for the show, at 808-868-3200. You can leave a recording there, and maybe we'll use it on a future show. These listener line shows are really important, and we appreciate them. Thanks again. Hopefully this serves you and your dog well. I'm wishing you a very warm aloha until next time.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.